I found out that I had leukemia after going to my physician numerous times for strep throat, colds, infections. Every time I would go to see him, he would take blood. And each time I visited with him, he would come back saying, "Your white blood count is exceptionally high. It's the highest I've seen." And after ruling out a number of tests, he sent me to an oncologist. And that's when I found out that I had CLL. I would probably say that my disease affects my daughter probably more because she's older and more mature. I know when I get sick, it just brings the whole thing up, and she wonders, what's going to happen. Am I going to be here to see my daughter get married? Am I going to be here to see my son graduate from high school? That type of thing. I think it takes a lot of courage for someone to participate in a clinical trial because you really don't know what the outcome is going to be. I was going back and forth to see Dr. Castro almost every day, which was, to me, was amazing how available he was and how concerned he was. He was calling me at home. He was, it made the whole experience, just so much better. It's so important for people to take part in these trials so that doctors can figure out a cure, a better way of treating cancer. My hope for the future is that the second phase of this trial will either put me into a permanent remission or take care of the disease altogether, but make it so that my future is bright and I don't have to worry about, getting really sick with the disease. In order for patient-centered research to continue, it means that there's a lot of other organizations that have to get involved, like Gateway, to help fund the research.